Yeah. So hi everyone, and welcome to this session. And I'm so excited, just like you all. I'm Ramatu Abdulkadir, and I'm the Executive Secretary, Kaduna State Health Supplies Management Agency. I know it sounds a mouthful. So as an Executive Secretary, I report directly to the Governor of Kaduna State. So I'm actually a political appointee. Yes, so I'm a politician. Yeah, you can say I'm a politician, but more of a technical kind of politician. So executive secretary will be the chief executive officer, the CEO, more of in your own terms. And my job includes providing medicines to all the citizens of Kaduna State. And we have over 8 million people in Kaduna State. So if you don't know about Kaduna State is the third most populous state in Nigeria. You can see it's also the political capital of northern Nigeria. And we have population density of 130 per kilometer square. And also you can see my governor on the side. He's such an inspirational leader, and he's one of the reasons why we do what we do. So when I took over the post of executive secretary in 2016, I was supposed to transform the public health supply chain. And believe me, if you've been to my warehouse, frankly, I think you will run away because the warehouse was in such a bad condition. I inherited staff that were demotivated. We had broken supply chains. We have 9 supply chains in Kaduna. So every program has a supply chain. We have supply chain for family planning. We have supply chain for HIV. We have malaria. We have non-tropical diseases. We have vaccine supply chain. And then we have the essential medicines. So it was totally chaos in the supply chain. And nobody knew what the other person was doing. There was so much wastage in the system. The 9 supply chain could be buying same products at the same time, but because they don't have visibility, so I would buy and you will buy, and we eventually end up in the same facility. And that led to a lot of wastage and huge expiries in the system. So when I took over, we decided to start cleaning up the supply chain. So, but my first worry wasn't about even cleaning up the supply chain in terms of fragmented supply chain. I met the warehouse in a very poor condition. So we had to start with physical cleanup, like literally scrubbing and cleaning and scrubbing for months, just trying to have that shine and just have people work in a very clean environment and enjoy also working there. So that was a big deal for us, and we've worked non-stop for 4 years, and now I have in leading a public health supply chain in the developing country. And I hope that this will help you out there. If there's anyone that wants to support a public health supply chain, I hope that my experience will help you to do the way I had to suffer. So I'm going to talk about the challenges of leading a public health supply chain, and I'll focus on what I like to call the people problem as it relates to supply chain visibility. And so there's so many problems in supply chain, but I think when we talk about supply chain visibility, there's always the misconception of thinking about equipment, softwares and platforms and all that. But today I want to focus on the people problem of the supply chain. Yeah. So when we talk about visibility in public health supply chain, like I said, the focus is on technology while downplaying the people role. And I see that every day. It happens every day. Once we mention supply chain visibility, people say, okay, let's go and get the software or the platform. And they feel that once you have the software or the platform, your problem is solved. But we found out in Kaduna State that this was not the case. As we have seen that even just getting a software or a platform doesn't solve your problem. There are so many complexities in the supply chain that a platform cannot solve. And because we're working towards a gold standard unified public health supply chain, and that of course leads to universal health coverage, We can have that discussion another day. It's all linked to the SDGs that Sherry had been talking about in some of our Brunch and Learn. Yeah, Sherry. Yeah. So, so when we look at the people problem of supply chain visibility, it has different dimension in terms of what it means for the public health supply chain. And I see visibility as turning on the lights throughout your supply chain. So what happens when you turn on the lights in your supply chain? Suddenly, you see 18, 20-foot containers of expired products lying in your warehouse for over a decade. And you just go like, whoa, how do I deal with this? How do I prevent this from ever happening? Should I pretend it doesn't exist like everyone else? Because that's easy, right? Let's just ignore the problem and it will just go away. You also see health facility managers fail to account for nearly 50% of products delivered to their facilities to provide healthcare service. And you ask yourself, do you want to raise this issue? Or should we let sleeping dogs lie? How do I deal with this? So these are all people problems. And you have to keep weighing it. What does it mean? Do I want to lose friends? Do I want to make new friends? And what the long-term implication means also. So you find yourself also, once you have visibility, you could find yourself rejecting free donations of products to avoid wastage due to expiry. Because now you know you have more than enough stock to last you a lifetime. So in the past, you could, any donation that comes to the warehouse, we'll just take it like, oh, but it's free stuff, right? Let's just take it. If you don't want to look, let's just take it. Yeah, it's free. But with visibility, you can't do that. You have to look at your stock. You have to look at what's happening. You have to look at your cost, inventory management, and how to even handle the product, if the patients are going to get the product. And then you look at it and see that you have over a year's days of stock. You're not going to collect that free gift. You're not going to collect that free gift. So you find yourself rejecting it. And people will tell you that you don't want to look a gift horse in the mouth. It's free. Let's just take it and keep it. But because I have seen the other end of free, and having visibility has helped us to be able to take better decisions and also run our supply chain better. So, and also when we look at it, supply chain visibility, even though you can see my screen now, this is a screenshot of the Kaduna supply chain dashboard. It's a one public health supply chain dashboard. Now we can see end to end, we can see facilities, we can see prescriptions, we can see products, we can see monies, and we can see everything moving on in the supply chain. But then it comes with huge, huge problems and huge responsibility. What do you do when you discover there's a problem in your supply chain? What do you do if the problem involves high-level people or your colleagues? Are you going to call them out, or you're just going to keep quiet and bury the problem? You will also see that supply chain visibility is closely linked to supply chain accountability and transparency. In Kaduna State, we're still working on our problems and dealing with the light-on issues, and hopefully we can inspire you to look at your public health supply chains. And my takeaway question for you today will be to look at your supply chains, your public health supply chains. Every one of us has one. We might not work in the public health supply chain, but definitely we have public health supply chains in our states, in our countries. So are the lights turned on? Do you have full visibility? Is it dim or is it pitch black? So those are the questions I want you to ask yourself. And then also, what will you do differently than Kaduna State? Thank you very much for listening.
This is like a teaser. There's
the flash poll. We should do a flash poll on the visibility.
We'll do the flash poll. Hey, Ramatu, while I'm getting the poll set up, can you explain how you got into the job you're in and what you were doing before?
Yeah, so I used to lead another supply chain transformation. I did lead a supply chain transformation at a tertiary facility. In Nigeria, we call it federal level. So there's a federal level, there's a state level, which is where I am now. So I led a transformation at the federal level. I worked at a tertiary specialist ear, nose, and throat center, where I was able to achieve visibility of almost 95%. We hardly had stockouts of medicines. And for me, it was just unacceptable that at the state level, we had 6% availability of medicine. In the same state, mind you, was the two jobs I did were all in the same state. And that was why I went into this job with so much passion to make a difference, which we have been able to do.
And can you talk a little bit about the difference between private healthcare and public healthcare? Because I think that'll be a new concept for people, and then layer on the complexity of the donor world. You talked about it a little bit with if somebody gives you something for free, but if you could talk about those two concepts, I think that'll be new for people.
Yes. So in the public health sector, is mainly supported by a lot of donors. There's huge donor support. Kaduna State, we have over, I don't know, maybe 30 or 40 donors supporting Kaduna State, but yet we still don't have medicines. And everybody is buying medicines, unlike the private sector. So private sector supply chains are run differently, but I must say that they are not any different from the public sector supply chain, because the whole distribution network is fragmented in the country. So both public and private sector go to the same market to get their medicines. And once the market is fragmented, it doesn't make any difference whether it's public or it's private. A lot of adulterated medicines, a lot of fake medicines. So but for the public health supply chain, it's such a shame that with so much support and people working in that area, Kaduna State had been lagging behind prior to 2016. But now I can tell you that we've come such a long way, but we're nowhere near where we want to be.
Cool. So we've got a ton of questions. Let's start with your two polls for people, and then we'll go to the questions. Does that sound good?
Yeah.
Cool. So Ramatu wants to learn about your supply chain. So we have two questions for you. Launching these now. The first is around how much visibility you have into your supply chain. Several options there. Her words are so much cooler. Even though we built this together, dim, totally black, the lights are off, the lights are on. So just help me out and translate the analogy yourself here.
Yes. So full visibility means the entire lights are on. You can see everything.
Stadium lighting.
Upstream, downstream, customers, suppliers, everybody is linked. Yeah.
Cool. We have about half people have responded. We've got a lot of good questions. Okay, I'll give 5 more seconds on the poll. Trickling in.
This is so cool that we also have a lot of new people this time, which is awesome.
It is cool. Welcome, everybody. Welcome.
I'm just trolling the comments. They're fantastic.
They are good. By the way, if you're not in the comments, open the chat box, because we heavily chat during presentations, which doesn't mean we're not listening. We are, as you can tell. All right, let me share these results with you. All right, there it is. Most people can see different parts of the supply chain.
Mm-hmm.
Cool. All right, now the next question from Ramatu is, what do you do with that visibility that you have?
We make siloed decisions. Of course we do, Deborah.
Maybe, or we put pretty dashboards on the TV in the hallway. Everything's
green. It's good. We're measuring at the right level. Everything's green.
Done.
Done. Wow.
So we've got
It's amazing.
about half of people. Nobody else can see it right now, Sherry. So, you know, way to build.
I'm gonna be quiet.
Way to
Sorry.
build anticipation for the answers.
I'm fascinated. I'm sorry. I'm just.
Yuri's just mad that he can't see real time. He's like, what?
We should
Okay.
enable real-time sharing.
5 more. I don't know if Zoom lets you do that. Oh, but you know what I'm going to do next week is do poll everywhere, and then people can see real time.
Yeah.
So we're going to use poll everywhere starting next week. Get ready, everybody. We're going to try a new technology.
I love that.
Okay. Some decisions based off the data. I feel like people aren't being totally honest. I think there's a lot of data being collected that's used for nothing. Nothing.
We make nice reports. That's the second most popular answer.
Great point.
Mhm.
25%. We make
That's my
pretty-
life. That's my life.
It's true.
And with that, you don't do anything with it. You make a nice report of it.
Fair D.
Tableau, yes, nice and shiny. Everyone puts it up at the SNOP meeting. Everything's green.
Everything's always green. Don't talk to us. We don't want to be talked to. We're the
I got my stuff streaming in the visitors lounge. It's beautiful.
Okay, we're going to go to a couple of questions, and there's a lot that has come in. So I'm going to go, since Bettina, it was just up on my screen. Bettina, do you want to ask your questions about setting up dashboards and challenges implementing tech? Do you want to ask that question live?
Okay, sure. Hey, Ramatu, thank you so much
Hi.
for what you shared already. I know I was chatting with you, and I don't even know what time it was the other day, but my question is, in regards to your dashboard, did you have assistance setting that up, and how did you come to select that option as a dashboard? And also, did you face any challenges in making sure that what you set up as far as inventory matched what was actually out in the warehouse?
Yeah, thank you, Bettina, for that question. We had huge challenges. We still have challenges. So that's a given. But it took us over 3 years to be able to settle on this system, this business intelligence solutions we're using right now. What you see is a Power BI dashboard. The state government has an e-governance Azure platform, which we use to build our system. And we have different databases. So we have a separate database for our prescriptions, where we collect consumption. That's what we call consumption, like demand, where we collect our demands, and from the facilities using an SMS-based platform. So that is also linked to the Power BI dashboard. We also have our warehouse management software, which has information for all the products in the warehouse, is also linked to the dashboard. So for the inventory, we don't have problem with inventory at the warehouse level, because we use our systems to ship products, and also to even pick, pack, and ship products to facilities. Where we have challenges is at the level of the facility. So at the facility level, you could ship products to the facilities, and they send you consumption, but it doesn't match with the stock balance they have on hand. So say I give you 10 products, and then you tell me you've consumed 2, but your stock balance is also 2. So where is 6? And so that is a discussion that we continue to have with facility people. Initially, it was a rude shock for the system, because people were used to nobody asking questions. Like, it's not possible. The executive secretary can never know where the products are. But now I just can call the facility maybe 3-4 hours away and tell the facility that no, we can't ship products to you, because I can see it on my dashboard that I still have products on your shelf. So that's what we do right now. It still has a lot of problems, has a lot of challenges, because it involves working with people at different levels with different educational backgrounds and understanding. So we have to do a lot of trainings. When we started this system, there were people that could not even send text messages. So they had phones, but they didn't know how to send text message. So we have to go down, teach people how to even send text message, and then teach them how to send it with codes, and it takes a very long while for people to get used to it. But going down the line, 4 years now, I can say we've really come a long way. We have a workable data that gets the discussion going.
Was it last week, Sherry, that you shared the story about Vicky B?
Vicky Trumbo.
Vicky T. So last time, everybody, for context, Vicky T was like a staff who knew everything, tougher to train, but once she got it, she was like a magical wizard. And it sounds like, Ramatu, some of these people are like Vicky's, right? They hold the world together. They know everything about everything, but to get them to that training point does take some effort. Ramatu, do you mind sharing a little bit, because I think it's so innovative and something that many of us would never think about. When you talk about SMS, for people mostly in America who aren't familiar with how the rest of the world talks about mobile, SMS is a short message. That's something. It's a text message.
Text, yes.
Normally done through WhatsApp, because get this, Americans, outside of America, mobile packages, data is usually unlimited, and texting you pay for. And texting over Wi-Fi when you don't have an iPhone, WhatsApp is usually the easiest one. So Ramatu, can you explain a little bit about when you say we do visibility over SMS? Explain the ingenuity that you use for that.
So it's like you rightly mentioned, it's text messaging. But what we did was we started by coding our products. So because you couldn't test, it had to be numerical. You have to, so we had to code our products. We also had to customize our prescription sheets, because those were the data collecting tool. You know, these prescriptions that doctors write on. So ours have unique ID numbers, and all the products in the warehouse and the entire supply chain also have their own codes. So we teach the facility people how to send these text messages using codes. So they use codes to send this message, and it hits our system, and that system is able to interpret those codes into products. And we can see the dashboard where we see products that have been consumed, products that have been damaged, expired. It also has reports for the facilities. It's real time. It hits the dashboard and it's real time. So, but even that seems very simple. At the beginning, we thought it was just really basic use of phones, because you see adults holding phones and you assume, oh, they can test, right? No, not everybody can test. So some are just using their phones for phone calls. So that was the stage we had to. Yeah.
Good. Okay, cool. Yuri, a little while ago, 10 minutes ago, you asked this question, and either you can ask it live, but there's two components of your question that has wildly different answers. And Ramatu, this gets to the complexity of your stakeholders. So Yuri, you asked something about foreign dependencies, and you ask about federal level versus state level. Do you want to ask that question?
Sure. So Ramatu, thanks again for your presentation. So you being at the state level, do you have any dependencies on foreign suppliers or raw materials, et cetera, that you have to negotiate with being at the state level? And does that conflict with anything happening at the federal level or with other states? Just curious on how any of that impact is handled.
Yeah, thank you, Yuri, for that question. And so we have a lot of dependencies on federal and foreign donors also. So some programs are run mainly by foreign donors, and some products come through the federal government to the state level and then down to the local government. We also have products that go directly from the federal to the facilities, and those are the fragmented supply chains I was talking about. So, and because these supply chains are fragmented, it could be a problem. For example, we have products that go from the malaria supply chain from federal to the facilities, while I also handle malaria products in my warehouse. So what happens is that when we deliver malaria products to the facilities, and then we get there, I mean, oh, they have malaria products. Like, where did you get those ones from? So it's such a huge complexity for us, and that is why we're working on our one public health supply chain. The dashboard you saw, okay.
Sorry, go ahead.
Yeah, so the dashboard you saw is us pushing a solution of a one unified public health supply chain, where all the different supply chains are going to be collapsed into one.
Thank you. So that triggered a couple more questions. So do you ever have risk of, when product is moving around the country, that you have shrinkage where product is showing up missing, where somebody may steal it or, I don't know, pirate it along the way? And then just curious if that's ever a risk for you all.
Oh, that is a huge risk. So I'll tell you what happened. When I came on board, we have a program that is called Free Maternal and Child Health Care Program. It's free by the state government. And when we give these drugs out to local government healthcare workers. They're supposed to take it to their own facilities and give it out to the facility. An entire truck can go missing. The whole truck doesn't get to the facility. So that is definitely a risk. And that was why during our transformation work, we decided to remove all the fragmented supply chains in terms of different warehouses. We had warehouse at the state level, warehouse at local government, warehouse all over. So what we do is that we ship products now directly to the facilities using third-party logistics. And once we started that, no product ever got missing from our own end. Yeah, again.
And then one last question. I'll stop being
Okay,
a ball
last
hog.
one then, Yuri. This is
We have a
really
lot.
you're running through your credits here. Is it wildly interesting?
It is. Do you
Okay.
have any risk of counterfeit in your supply chain as well?
Yes, I talked about that during my presentation. That is, it's always there. It's because of the type of distribution network that we have in the entire country, not particularly for Kaduna State. So substandard, fake, outright fake, so many different and shady things that goes on in the supply chain. And even though at the federal level, we have an agency that is specifically supposed to take care of that, but that there's still a lot of work that needs to be done. So from our own end, what we do is that because of the work we have done, we've built relationships, strategic relationships with very credible suppliers that we've been able to accredit. And a lot of transaction is based on circle of trust. Assuming that you've been running business with me for 5 years, I don't believe you want to lose that business just because you want to cut bills. So we try to stick to our accredited suppliers that are reputable. We don't just go for cheap. And that's one of the problems we have. When you want to go for the cheapest drug out there, then you're likely to meet counterfeits.
And fun fact for the day, everybody, not super fun. Healthcare is the #2 most corrupt industry in the world. 1 in 12 medicines in the world is counterfeit. It's absolutely fake. So Ramatu talked about substandard, so just less effective versus actually fake. 1 in 12 is fake. In African countries, it's more like 1 in 6. And so the struggle is real. The battle is a real thing. And it's a massive, massive problem. But moving on, Gerald, you asked a question about the goals and what does good look like for public versus private. You want to ask that question?
Yeah, thanks for the opportunity. So in the private supply chains that I've worked in, we've always tried to figure out what's the goal for optimization. And oftentimes it's financial in nature, like return on invested capital, finding a way to get the product sold to the most profitable, customer. It seems like those wouldn't be the same goals for public health. Could you talk a little bit about what the actual goals are, whether it's on-shelf availability, lives saves? What is that other goal other than financials that drives the public health supply chain?
Yes, so for public health supply chain is basically to save lives. No other goal apart from saving lives. It's not about the profit, and that's why most of the programs are free. They are either free or subsidized by the government. It's merely to save lives. Nothing like profit like in private sector. And also that also provides this perversive incentive for people to also steal the product and all that. So definitely the policies also, we've been discussing about policies more recently, how government can leverage on using policies that also speak back to implementation, because it doesn't make sense when you're giving out free products and some people are just stealing the product. It's better to look at the system and see how you can have a more consistent policy in terms of implementation of different programs.
Thank you.
I thought that Claudia made a really interesting point. She made a couple
Next
around
on the list.
CSR and how your focus changes from profit to impact. And I think that that's something that we talk a lot about, how supply chains are shifting from this cost optimizer to really value catalysts. And when you think about public health supply chains through the lens of CSR, it's really a new world. It requires a new mindset. So can you give us a little flavor around you know, what good looks like through the lens of CSR, Ramatu?
Yeah, thank you, Sherry. And like you said, that's very new for public health supply chains, but it's something that we have been toying with most recently. So, and so in our supply chain, what we have tried to do is see how we can impact or give back to the community in terms of, and we use education to do that. So we have some partnership with Kaduna State University, where we're running a supply chain education hub. We're running a supply chain education hub for training of people, professionals in and outside the public health space. And we try to advocate and also teach people about how we need to take care of our supply chain and how that leads or how that piggybacks into the entire system. It's not very matured yet, but it's definitely an area we've been looking at. We've been looking at circular economy. Thanks to Deborah, we're trying to see how we can make use, reuse, and all the R's. I've engaged my team in some of those activities, and it's amazing what we can do. But definitely, because public health supply chains are very complex, the stakeholders are varied. Everybody has to be in on it because it's not profit driven. So you can't ask where's the money to go for CSR. But definitely, we're doing that in our own way in trying to share knowledge. We have knowledge sharing hub where we teach young people, interns from university, and we just teach them, we reach out to them and try to build better leaders that are going to lead our future supply chain.
Awesome, thanks. So listen, everybody, time for one more question, and I've just posted it in the chat where you can see Ramatu's blog. She's done a 2-part series, which is probably going to expand to a 3 or 4-part series. And I've given you the link there to her blog on part 1. Part 2 comes out in the next couple of hours. But Aminu, your question is a really good one. Do you want to ask that live? And that'll be the last question. We'll go to breakouts after that. Aminu, if you have sound, you're muted, or I can ask your question. Okay, I'll ask your question. Aminu says, I know your job, like those of others or more mature ones, are built on continuous improvement. At what point would you consider or say that we've reached that level of comfort? So the point that you can go into continuous improvement. Do you want to talk about that a little bit?
Yeah, so I think right now we are at that point. 4 years, we've been able to build some structures, and we are falling into some routines, and it's a great time for us. We've started continuous improvement, and this is going to take decades. So I started the transformation, but definitely I'm not going to finish it. It's going to take a very, very long time, 10, 20, 30 years down the line. Kaduna State is likely going to be in that continuous improvement mode forever. Looking at the concept of continuous improvement, you can't really rest on your laurels. So basically, we're already at that stage now.
Fantastic, very cool. Listen, thanks everybody for your questions. We're gonna go to breakout now. Ramatu, what question are we going to explore during breakouts?
Yes, I thought I had a question for the breakout.
Yes, do you remember it? Do you remember it? Or?
I do. Yeah, I think I do. So during breakout, I want you to tell me how you will solve problems in your supply chain. So you have visibility, you discover a problem, then what? Are you going to sweep it under the carpet? Are you going to notify? Are you going to call a friend? What are you going to do when you discover a problem in your supply chain? Thank you.
So
I want to be Ramatu's breakout.
Okay, hold on. I can make that happen, but I just have to look for a sec. I'm making sure everybody has at least 4 people. I know some people are called in on their phones and aren't able to unmute themselves. So I'm going to increase the size of the room a little bit. And I know people are clamoring over themselves to get into Ramatu's room. So I'll do my best, Sherry, to put you into Ramatu's room. But Bettina's already there, so I feel like she's covered. Cool, so listen everybody, question is, when you encounter a challenge, what do you do? Do you ignore it just a little bit? And at what point do you stop ignoring it and actually solve it? We're gonna spend 8 to 10 minutes on this. I'll check in with a couple of you and see, apparently Joe is running out of wine. I'm on my second cocktail.
Where's
so if
mine?
you need to go and replenish, now is your chance. I have my stocking system here next to my bar that is fully ready with all of my cocktail needs. All
Can
right,
I just
8
say
to 10 minutes.
one thing,
Yes, Sherry,
one
please
thing.
do.
Okay,
Please
we
do.
need to publish the chat. So we need to copy
Yes.
the chat, but then
Maddie, can you please
also
help us?
this is a great way to start the conversation. There's so many cool ideas. We need a subreddit for this. We need to put it on Reddit.
All right, when we
Because
come
this
back,
is
we're going to
amazing.
do a lesson on Reddit because we have
Okay.
like 23 members, which is more than we did to begin with, which was me and Sherry, and how Reddit works. Because Reddit is basically just one long chat, but it's a better format than like LinkedIn or whatever. So we're going to do how to Reddit after that. So
Yeah, perfect.
I'm going to make a few changes and then we're going to go to Breakout. So Sherry,
Thank you,
say
Deborah.
something else really interesting so that I can do this really fast.
I just want to say that Ramatu is a boss, and there was a really large tree, and she has a story about how one weekend she was like, we have a problem. We're going to solve it. Guess what? You, and this solution will pay for itself. And it's an amazing story. And she has pictures, and I think there's a video somewhere.
Ramatu, can you just tell the story really fast? Otherwise, I'll tell it.
She's a boss, okay?
Yeah, so thank you, Sherry. So there's this big 3 stumps. We have so many stumps.
By
when I
big,
took
she
over,
means like
that
10
really
feet
building.
across. 10
That's
feet
a building.
across.
Yeah, yes.
It's a tiny
And
home.
Yes, and that stump is actually obstructing a warehouse. So normally when a truck comes in and is trying to back out from the warehouse or back in, it's very difficult. It could take 30 to 45 minutes just doing that. And I just watched and everything and kept wondering, so why is this tree stump here? And nobody could answer. Some people had some myths about the tree stump. Maybe there's something happening or something, I don't know. So one Sunday morning, I mobilized some people and we went down, cut down the tree. And we came back on Monday morning and everybody was like, what happened around here? And I just kept me like, I don't know.
Okay. And one of the people was a snake charmer.
Stop it.
Yes.
Yes. A snake charmer.
Yes. So of course, and apart from tree stumps, we had so many snakes. It was a snake-infested warehouse, like real big snakes. No joking about that. I was really, really scared for my life. And I had to get some snake charmers to come in and take out the snake, but we argued about how to pay them. Like, they didn't get so many snakes.
The best quote I have from that time, Ramatu would send me daily pictures, and the best quote I have was, you should have heard those men scream when they woke up the cockroaches. That was the best quote I have. Okay, everybody, how do you solve problems in your supply chain? And now I'm sure the problems you experience seem just a little bit different after hearing Ramatu. But 8 to 10 minutes, here we go. Have a great time. See you back.